Modern healthcare facilities have a lot of requirements for mobile patient point of care applications. The patients themselves all have mobile devices and want to stay in contact with their friends, their loved ones.
There could potentially be patient harm if we didn't have our systems to rely on. Guthrie Hospital is a 220,000 square foot building. We have 65 inpatient rooms, 18 cancer treatment center bays, and 20 private rooms in our emergency department. Our previous hospital was built back in the 60s when there was a much more of a major focus on inpatient hospitalization. And as we know, across the country, that has now changed and there's so much more of a focus on outpatient. So we've designed this hospital with the patient in mind. What is it our patients need? How can we provide for that? And how do we make sure we've got all of the technology that we need to support what's required?
Caregivers need connectivity on a wired basis for certain applications like telemetry, and they need redundant backup systems. On the wireless side, caregivers need to have mobility, so they need to be able to get through the hospital while maintaining connectivity.
It's important in our medication administration, it's important with our electronic health record, and certainly in our operating rooms, radiology suites, and all of those areas. We refer to the IT and cellular system as the nervous system of our hospital. Our employees and staff, physicians, are the heart, but this nervous system is really what keeps us all running, and without those connections, the work that we do would really be impaired. So we knew we had to go out and find strong support and a state-of-the-art partner for supporting our IT system.
When you get involved with a project like we have here at the hospital, typical infrastructure has a certain playbook, and the playbook is home runs of copper back to the nearest closet. The big challenge is that we found ourselves throwing the playbook right out the window. We had to get single-mode fiber connectivity as close to end user as possible. Guthrie had several challenges. One was to reduce power wherever they could in the facility. Two was to try to save space. They were looking at the potential of having their telecom closets 90 to 95% full at opening.
The team's initial approach was to use a hybrid copper-fiber solution. We were planning to use the GPON system for all of our network requirements and a separate coaxial-based system for the distributed antenna system to enable cellular coverage.
As we proceeded through the design process, we realized that would be cost prohibitive, require a lot of redundancy and cable pathways, equipment spaces, cooling power requirements. And so we realized that with the emergence of the Corning One solution, we were going to be able to converge everything onto a single infrastructure. By allowing us to have an all-fiber solution, we can kind of collapse and converge all of those different systems onto one infrastructure, saving space, saving time, saving money.
So what makes Guthrie's use of the One platform unique is that the platform is being leveraged for voice and data cellular, for Wi-Fi, and then from a local area network perspective, it's enabling OR integration equipment, access controls, nurse call and paging applications, building automation, and security cameras.
The Corning One wireless platform allows clinicians to move from a static, tethered type of workstation to something that's much more mobile, flexible, right? So for instance, we can, where MRIs used to have to be viewed at a static workstation, right? We can now take that, put that on a tablet or a mobile workstation and bring that right to the point of care with the patient so they can support all of their point of care applications, their PACS imaging, diagnostic tools, and then it also positions them very well for the future moving forward since fiber has almost limitless bandwidth potential.
The physicians can view the patient's record from their office, they can view it from home, and it just makes it for a much, much better integrated chart and better care for our patients.
From a patient's perspective, being able to video chat, maybe via Skype with your friends and your family, kind of update them on what your status is, makes you feel a little bit more connected.
We know that our community needs, patient needs will be changing, and that we'll need to grow and change our services accordingly to meet those needs. And having this platform in place will enable us to be able to do that.